Tonight, a growing public health investigation is drawing national attention after thousands of reported illnesses linked to a rare intestinal parasite were identified across multiple states. Health officials are working to determine how the outbreak spread, investigators continue tracing a suspected food source, and questions remain about whether the reported cases are connected by a single contamination event or several unrelated outbreaks. Across hospitals and clinics, physicians began seeing patients with nearly identical symptoms: persistent watery diarrhea, severe abdominal cramping, extreme fatigue. For many, the illness lasted far longer than expected, with some patients reporting symptoms that continued for weeks before laboratory testing identified the underlying cause. Unlike a typical stomach virus, investigators say this outbreak involves Cyclospora cayetanensis, a microscopic parasite that causes an illness known as cyclosporiasis. While infections are reported every year, health officials say the scale of this investigation is unlike anything normally seen during a typical summer season. As epidemiologists continue examining patient interviews, laboratory findings, and food distribution records, the investigation remains active. Authorities are working to determine exactly how the contamination occurred, whether every reported illness is connected, and what additional information may emerge as testing continues. According to health officials, reports of illness began increasing during the late spring. At first, the cases appeared unrelated. Patients sought treatment in different cities, visited different hospitals, and had no obvious connection to one another beyond experiencing similar gastrointestinal symptoms. In most years, isolated Cyclospora infections are uncommon and are typically investigated as individual cases or relatively small clusters associated with fresh produce. Initially, there was little reason to believe this year's reports represented anything unusual. That changed as laboratories in multiple states began confirming additional infections. State health departments routinely monitor laboratory-confirmed cases of foodborne illness throughout the year. As more results were reported, epidemiologists noticed a pattern beginning to emerge. Separate jurisdictions that would ordinarily investigate illnesses independently were identifying the same parasite in growing numbers of patients over a relatively short period of time. The increase prompted additional coordination between local health departments, state laboratories, and federal public health agencies. As investigators compared laboratory findings and patient interviews, they recognized that many of the reported illnesses shared remarkably similar characteristics. Patients consistently described prolonged watery diarrhea, abdominal cramping, fatigue, nausea, loss of appetite, and, in some cases, significant weight loss. While the severity of symptoms varied from person to person, physicians noted that many patients remained ill considerably longer than would normally be expected with more common gastrointestinal infections. Those clinical similarities became the first indication that investigators might be dealing with something larger than isolated cases occurring independently. Foodborne illness investigations rarely begin with a clear answer. Instead, they develop gradually as laboratories identify infections, physicians report diagnoses, and epidemiologists begin assembling information from hundreds of individual cases. Cyclospora presents additional challenges because of the way the illness develops. Unlike many forms of food poisoning, symptoms often do not appear immediately after exposure. Health officials say patients may not become ill for several days, and in some cases more than a week, after consuming contaminated food. That delay complicates nearly every stage of an outbreak investigation. By the time patients seek medical care, they may have eaten dozens of meals since the original exposure. Remembering exactly what was consumed, where it was purchased, or when it was eaten becomes increasingly difficult. For investigators, those details matter. Each confirmed patient is interviewed using a standardized questionnaire designed to identify possible common exposures. Investigators ask where patients shopped, which restaurants they visited, whether they purchased fresh produce, whether anyone else in their household became ill, whether they had recently traveled, whether they attended public events or shared meals with others. Individually, those interviews often reveal very little. Collectively, however, they allow epidemiologists to compare hundreds of cases at once, searching for patterns that would otherwise remain impossible to detect. As additional interviews were completed, investigators began identifying several foods and distribution networks that appeared repeatedly among unrelated patients. Those findings marked an important turning point in the investigation. Rather than examining isolated illnesses, health officials were now evaluating whether separate cases reported across multiple states could share a common source. Once investigators identify a possible pattern, the focus shifts beyond patients themselves. Attention turns to the food supply. Public health investigators begin what is known as a traceback investigation, following products backward through grocery stores, restaurants, distributors, processors, and agricultural suppliers in an effort to determine where separate supply chains intersect. According to information released during the investigation, one food item appeared frequently enough in patient interviews to warrant closer examination: iceberg lettuce. That finding did not, by itself, establish that lettuce was responsible for every reported illness. Health officials have repeatedly emphasized that patient interviews identify statistical associations rather than definitive proof. laboratory analysis, environmental sampling, and distribution records all play important roles before investigators can draw broader conclusions. Nevertheless, the recurring appearance of lettuce in patient interviews prompted investigators to examine supply records from restaurants and retailers identified by those affected. As additional information became available, public health agencies expanded their investigation to include specific distribution pathways associated with those products. The findings also led to recalls involving products linked to the investigation, while officials continued evaluating laboratory evidence. Investigators caution that foodborne illness investigations often continue well after recalls are announced. By the time contaminated products are identified, much of the food involved has already been consumed or discarded, making laboratory confirmation significantly more difficult than many people realize. That is one reason health officials continue describing the investigation as active. Patient interviews, laboratory findings, environmental testing, and supply chain analysis all contribute separate pieces of evidence. Only after those pieces are assembled can investigators begin developing a clearer understanding of how the outbreak unfolded. For now, that work continues. As investigators continued analyzing the outbreak, laboratory testing confirmed they were not dealing with one of the more familiar causes of foodborne illness. The organism responsible is Cyclospora cayetanensis, a microscopic parasite that infects the small intestine and causes an illness known as cyclosporiasis. Although the symptoms often resemble common food poisoning, health officials say there are several important differences. Norovirus, for example, spreads rapidly from person to person. It can move through households, schools, hospitals, and cruise ships in a matter of days because infected individuals are capable of transmitting the virus almost immediately after becoming ill. Cyclospora follows a different pattern. According to public health agencies, the parasite requires time in the environment before it becomes capable of infecting another person. As a result, direct person-to-person transmission is considered uncommon. Instead, outbreaks are more often associated with contaminated food or water introduced earlier in the production process. That distinction changes the entire focus of an investigation. Rather than tracing close personal contacts between patients, epidemiologists concentrate on identifying foods consumed by hundreds of unrelated individuals who may live hundreds of miles apart but unknowingly purchased products originating from the same supply chain. The illness also develops differently. Unlike many forms of food poisoning that produce symptoms within hours, Cyclospora infections often develop gradually. Patients may not experience symptoms for several days, and in some cases more than a week after consuming contaminated food. By the time they become ill, identifying the meal responsible is considerably more difficult. Health officials say the most commonly reported symptoms include prolonged watery diarrhea, abdominal cramping, nausea, fatigue, loss of appetite, bloating, and unintended weight loss. Some patients also experience low-grade fever or vomiting, although symptoms vary from person to person. For many, the illness is not measured in hours or even days. Without appropriate treatment, symptoms may continue for weeks, and in some cases, improve temporarily before returning again. That prolonged course is one reason physicians often order additional laboratory testing when routine gastrointestinal illnesses fail to resolve as expected. Each confirmed diagnosis provides investigators with another opportunity to compare patient histories and determine whether illnesses reported in different communities may be connected. As epidemiologists continued comparing interviews, one category of food repeatedly appeared during the investigation: fresh produce. That finding was consistent with previous Cyclospora outbreaks investigated over the past several decades. Unlike foods prepared at high temperatures, many fruits and vegetables are consumed raw. Because they are not cooked before serving, there is no final heating process capable of destroying microscopic parasites that may be present before the product reaches consumers. Leafy vegetables present additional challenges. Their layered structure creates numerous folds and creases that can make microscopic contamination more difficult to remove than on produce with relatively smooth surfaces. Health officials continue recommending that consumers thoroughly rinse fresh produce before eating it. At the same time, food safety experts emphasize that washing produce should be viewed as one part of an overall food safety strategy rather than an absolute guarantee. If contamination occurs earlier in the supply chain, prevention depends largely on agricultural practices, irrigation water quality, harvesting procedures, processing standards, and transportation controls implemented long before products arrive at grocery stores or restaurants. Those safeguards are designed to reduce risk throughout the production process. When investigators identify a possible contamination event, they work backward through each stage of that system, reviewing production records, distribution documents, and supplier information, while comparing those findings against laboratory results and patient interviews. It is a process that often involves cooperation among local health departments, federal agencies, food safety specialists, and agricultural inspectors. One of the most difficult aspects of any nationwide foodborne illness investigation is establishing an accurate timeline. Unlike outbreaks involving a single event or location, widespread foodborne illnesses develop gradually. the first patient may become ill days before another individual purchases the same product. Additional illnesses may not be reported until laboratory testing confirms the infection, extending the investigation even further. By the time investigators recognize a broader pattern, weeks may have passed since the original exposure. That delay affects every stage of the response. Patients must recall meals consumed many days earlier. Restaurants review purchasing records. Retailers examine inventory histories. Distributors trace shipments through regional warehouses. Suppliers reconstruct production schedules. Each step helps investigators narrow the search while eliminating possible explanations that do not match the available evidence. Health officials say this methodical process is essential because early assumptions do not always withstand further investigation. As new laboratory findings become available, investigators may refine earlier conclusions, expand the scope of an investigation, or determine that multiple unrelated events occurred during the same period. That possibility remains one reason officials continue describing the investigation as active. Rather than focusing on a single piece of evidence, epidemiologists evaluate hundreds of independent findings before reaching broader conclusions. The objective is not simply to identify a suspected source. It is to understand the complete sequence of events that allowed contamination to move through the food supply so similar outbreaks can be identified and addressed more effectively in the future. While foodborne illness investigations often begin with uncertainty, they follow a structured scientific process. Physicians diagnose patients, laboratories identify the organism, health departments compare reports, epidemiologists analyze interview data, food safety investigators trace products through the supply chain. Environmental specialists examine agricultural and processing practices where appropriate. Each discipline contributes information that, on its own, may appear incomplete. Together, those findings allow investigators to develop a clearer picture of what occurred. That process has continued throughout this investigation as health officials work to determine how reported illnesses may be connected and whether additional findings emerge through ongoing laboratory analysis and epidemiological review. For consumers, much of that work takes place behind the scenes. The interviews, the laboratory testing, the shipment records, the production logs, the scientific analysis, all of it forms part of an investigation designed to answer a straightforward question. How did a microscopic parasite move through one of the world's most complex food distribution systems and ultimately affect people in communities spread across multiple states? That question remains at the center of the investigation, and it is one investigators continue working to answer. As the investigation continued, officials faced a question that would shape every stage of the response. Were all of the reported illnesses connected, or were several separate outbreaks occurring at the same time? According to health officials, that determination is rarely immediate. Large foodborne illness investigations often begin with what appear to be isolated cases reported by physicians and laboratories in different parts of the country. Only after those reports are compared through national surveillance systems do investigators begin identifying patterns that may suggest a broader public health event. In this investigation, epidemiologists continued evaluating laboratory-confirmed infections while comparing patient interviews collected by health departments across multiple states. As additional information became available, investigators examined whether reported illnesses shared common exposures, common purchasing histories, or common distribution routes. At the same time, officials cautioned against assuming every reported infection originated from the same source. Cyclospora infections occur every year, particularly during the warmer months when fresh produce consumption increases. While investigators may identify one significant cluster of illnesses, unrelated cases can occur at the same time, creating a more complex picture that requires careful analysis before conclusions can be reached. That distinction remains important. A nationwide increase in reported cases does not automatically indicate that every patient was exposed through the same product or the same supplier. Instead, investigators evaluate each cluster individually while also determining whether separate investigations eventually converge on a common source. That process continues as additional laboratory results are reported. The investigation has also highlighted how dramatically the food supply has changed over the past several decades. Today's produce moves through an extensive distribution network designed to deliver fresh products quickly and efficiently across North America. A single shipment harvested at one location may be processed, packaged, and distributed to regional warehouses before reaching restaurants, grocery stores, and food service providers across numerous states within days. That efficiency provides consumers with year-round access to fresh fruits and vegetables. It also means that when contamination occurs, identifying where it entered the system can be exceptionally difficult. Investigators must examine every stage of the distribution process. Where was the product harvested? Where was it processed? Which distributors handled it? Which retailers received shipments? Which restaurants served those products? And over what period of time were they available to consumers? Each answer narrows the investigation. Distribution records are compared with patient interviews. Purchase histories are compared with shipment logs. Laboratory findings are compared with environmental information collected during the investigation. Only after those independent pieces begin supporting the same conclusion do investigators develop a clearer understanding of what occurred. Health officials emphasize that this process is evidence-driven. As new information becomes available, investigators may strengthen earlier findings, revise previous assumptions, or identify additional areas requiring further examination. That flexibility is an essential part of every major foodborne illness investigation. For most Americans, the investigation became visible only after national headlines began reporting the outbreak. Long before that, however, the public health response was already underway. Every confirmed laboratory diagnosis entered surveillance systems used by local, state, and federal health agencies. Those reports allowed epidemiologists to detect unusual increases in illness that might otherwise have appeared unrelated. Without that surveillance network, isolated cases reported hundreds of miles apart might never have been recognized as part of the same investigation. Instead, physicians, laboratories, and public health officials worked together to identify patterns that no single hospital or community could observe independently. That collaboration forms the foundation of outbreak detection. Individual cases become clusters. Clusters become investigations. Investigations lead to laboratory analysis, product tracing, and, when appropriate, public health advisories or recalls. It is a process that operates continuously, often without public attention, until an investigation reaches a scale that requires broader communication. Officials say those surveillance systems remain one of the most effective tools available for identifying emerging foodborne illness outbreaks before additional people become ill. The investigation into this outbreak remains ongoing. Health officials continue evaluating laboratory findings, patient interviews, and food distribution records as they work to better understand how the reported illnesses may be connected. While investigators have identified significant patterns requiring further examination, scientific investigations of this scale are rarely completed quickly. Every laboratory result, every patient interview, every shipment record, every environmental sample, each contributes another piece to a much larger investigation. For consumers, the outbreak serves as a reminder that food safety extends far beyond the kitchen. It begins on farms, it continues through processing facilities and distribution centers. It depends on transportation systems, retailers, restaurants, public health laboratories, and disease surveillance programs working together to identify problems when they occur. When those systems detect an unusual pattern, investigators begin the painstaking work of determining not only what happened, but how it happened. That work continues today. As additional evidence becomes available, health officials say the public will receive further updates regarding the investigation and any recommendations considered necessary to protect public health. Until then, investigators remain focused on answering the questions that have guided the investigation from the beginning. How did the contamination occur? How extensive was its impact? And what can be learned to better prevent similar outbreaks in the future? Those answers will come from laboratory science, epidemiological analysis, and careful review of the evidence, not from assumptions. For now, the investigation continues.